Well, thank you so much for having me here today. Hello, developers. My thought about Blackout Day, actually, is, and its connection to us being here is, it's a special day because I think it is the first time that the developer community and the web community is going to flex its political muscles in a way that the entire world takes notice. You can't black out the Google logo on search and Wikipedia without people noticing and calling their attention to this very bad piece of legislation. This community has power. You have power. We're showing it today with a blackout, and we're here to talk about how you can use the power that you have not only to start great businesses, but to improve health outcomes. And that's a terrific and inspiring thing. And I want to spend 15 minutes just talking about how I see those opportunities and challenges. Simple. Okay. I don't think we need to spend a lot of time talking about the fact that this is an era of lots of good news for startups. I think we're going to look back at these years as another golden era of innovation in which all sorts of great things got started. Why? Well, there are lots of new platforms that are in the hands of billions of people with smartphones that are just begging for interesting and valuable things to do with them, and that's a new development. It is a lot cheaper to start companies than it used to be because of the cloud, because of all of the open source software, and that's terrific. An investment dollar goes 10 times further than it did 10 years ago, and that's remarkable. There is a lot more knowledge out in the world about how to do startups successfully. And so it is possible to be a brilliantly successful 19-year-old entrepreneur, and we all know a number of them, because there are no longer mysterious secrets. There's enough that's been written and understood and a supportive culture that spreads the knowledge, and that's a terrific thing. And because of all those factors, time to market is shorter. The gap between when you have the idea and when you actually have something that people can use and that begins to make a difference is way shorter than it used to be, which means for a given amount of resources, you can have more iterations to get to something that's successful. Well, all of those trends are enormously positive ones, and there are good reasons to be excited about startups. We've invested in about 85 seed stage companies over the last 5 years. It's a fairly good data set, and I just want to share a couple of modulating observations. I still think overall there's good news, but I think there are some challenges even with all the good news about startups, and they're worth being aware of and thinking about. So one, a fast start doesn't mean a quick win. I like to use a mountain climbing analogy. If your goal is to get to the top of Mount Everest, it does not matter how many miles you make on your first day out of base camp. It matters that you get to the top of Mount Everest. And doing a lot of high altitude travel under stress is still hard. I don't care how many miles you get on the first day. And so looking at, well, how many downloads the new app got in the first week, or how many people signed up, or any of the other common measures that startups have today for fast start out of the gate, what I would say is, yes, indeed, it is a fast start out of the gate. But getting to the top of the mountain is still pretty hard. It's a team effort. It takes longer than you would think. It is almost always quite a lot harder than you think when you're starting out. And the lesson is, be prepared. And we can talk about what be prepared means. Don't get overconfident. Don't get cocky. Keep your eyes on the goal, which is to get to the top of the mountain. There are lots, I think part of what brings all of us here today is a conviction that not only are there a lot of great startup tech opportunities generally, but they exist in the health field right now today. You're working on them now, or you're planning on working on them, and I share that specific enthusiasm, partly because these new platforms of smartphones and little gizmos that do useful things for us, it's just exploding with opportunities and possibilities. The fact that we can now aggregate very large data sets easily and crunch them and gain wisdom about what's going on from big data, that's a very big deal. Could never do that before, and that has lots of implications for health. And the whole kind of quantified self movement, the idea that it's interesting and worthwhile, we can actually measure things about ourselves in many different domains, physically, mentally, socially, and then use that data to do things. That idea is, that's a big idea, and it's coming to fruition, and lots of startups will be based on that. And you just couldn't do that before. You couldn't give people feedback so that they control their own destiny, so that they can know what is going on with them. And we'll see lots of things in the health space. So those particular trends are ones that I know many of you are riding on or are planning on riding on, and I say that's terrific. On the other hand, point about that is the following, which is I really think the exercise of founders thinking about the impact that their startup will have if it succeeds is very important. Obviously, we want to have a positive economic impact for yourselves, for your investors, if you have investors. But I believe we should be looking at the full spectrum impact in all dimensions. And one of the key questions we ask ourselves when we look at a startup is, what's the social impact going to be? And who is going to benefit from this if it works? And in a world in which there are still very significant healthcare disparities across age, gender, race, ethnicity, and other dimensions, will this particular startup, whether intentionally or not, increase those gaps or decrease those gaps? So, yes, I'm a believer that a rising tide lifts all boats. So if you build some kick-ass platform that helps people be healthier in any way, that's a good thing, but I don't think the analysis should end there. So we see lots of startups, for instance, lots, that have identified an opportunity to help people improve their fitness. There are workouts they can do at home or things that go in the gym. They give various kinds of feedback about performance. They track what you're doing, and we've seen at least a dozen of those. All well and good, but the question we ask the teams is, so if this works, does this mean people are affluent enough and have time enough to have gym memberships, for instance, are going to benefit from this, and they're going to be healthier, and people who aren't? In other words, who is this for, and does it disproportionately benefit people with more resources? Because that's a choice you could make. Or you could make a choice to apply whatever it is you're doing in ways that not only help everyone, but particularly help people on the far side of the healthcare divide. And let me illustrate just a couple of examples. They are from our portfolio. I'm not trying to push our investments particularly, but I know these two companies, and they're illustrative, and I think they're good examples among many. So one is a company called Asmopolis, which is based in Madison, Wisconsin, which is why you may not have heard of it, but they make a little wireless sensor that sits on top of an asthma rescue inhaler. So every time the asthma sufferer uses their rescue inhaler, because they're having trouble breathing, it sends an event up into the cloud of who, when, and where. And that data, both individually and collectively, can be aggregated to provide feedback, can be used to provide feedback to the individual, for instance, to remind him or her to take their regular medication, because compliance, especially among young people with asthma, is not very good, and that's why people wind up back in the emergency room or even being hospitalized. Similarly, you can aggregate all the data of who's using it, and if you see a sudden upsurge of use in a certain geographical area, it may be that there's a pollution problem there, that there's a spill or that air conditions there. It is a public health red flag. So the premise of the company, which has been validated, is that if you can get these into wide circulation, you can actually keep people out of the emergency room. And that's where the costs in healthcare are. So for maintaining a very expensive chronic disease. So you can make a business out of improving health outcomes, and making money doing it. And if you look at who has asthma, it's disproportionately people in low-income communities of color. They tend to be situated near and in situations that are asthma-inducing. So the success of Asthmopolis, if it is successful, I should say it's in advanced pilots now, hundreds, thousands of people, but not fully marketed. Part of the reason we were attracted to it is that it embodies doing well and doing good at the same time. And so that's a choice you can make if you're doing a healthcare startup, to think about the impact across populations. And in two sentences, just about Omada, which was in the first Rock Health group, which we and a number of other people have invested in. It is a similarly scaling a diabetes prevention program to be able to offer it online, hence to very large numbers of people who are pre-diabetic, to help them get that under control. And diabetes, once again, is a chronic disease that disproportionately affects disadvantaged communities. So we like that as well. So as you go forward as a member of a founding team, thinking about the impact dimensions of the healthcare startup is something that I think everybody has both an opportunity and a responsibility. So last few points. I started out as a developer and a technologist, and then became a designer, and then became an entrepreneur. And this is all ancient history. I love and can get lost in the beauty of just writing great code and making machines dance through hoops and do things. It's a wonderful thing. But you're all situated in working to make actual startups actually, your developers are like the necessary amino acids to really make startups go. And my point there is you can't not think about or be aware of business model issues, even though that may not be what you spend most of your time on. If you just let that be somebody else's problem, that's a mistake. These are tough markets to crack. We've seen that. The existing model in healthcare that we've had, this fee-for-service model where you get paid as a healthcare provider if you see someone in an office or if you do a treatment, you don't get paid for making people better. That is not a market incentive. That's the essence of why the system has been broken. That's the essence of why it's been really difficult up until now to do significant amounts, see significant amounts of success in healthcare IT startups. And the consumer market, which people have tried to use, of going around and say, well, we'll sell something for $5.99 a month or $9.99 a month to consumers who will pay out of pocket, isn't a great workaround. Yes, it works sometimes, but the issue is consumers don't really want to pay out of pocket on top of their existing insurance premiums. And why should they? It's crazy. Yes, there will be exceptions. But to try to build a whole industry based on consumers going out of pocket so that you can get around the broken insurance system, that's kind of a non-starter. The good news, and it's partly why we're investing in healthcare, and I think why other people are and why this is a new era, is things have really started changing as to how healthcare providers get paid. And we're entering the era where they can be paid for actually making people better, for achieving better health outcomes. It's starting with Medicare and Medicaid and some of the large private insurers, and this is not the seminar on accountable care organizations or medical homes. But what I would say is that there is at last opportunities for startups to partner with some of the emerging players in healthcare that are the intermediaries to work together on business models where you actually get paid for making people better, for improving some type of outcome. And that is really great for startups. We're in the early innings of that. I think there'll probably be a number of unfortunate casualties here of people who had the right idea and were doing the right thing and were a year or two too early. But of course, it's always better to be too early than too late, because if you're too late, you have 0% chance of success. If you're early to a market and you're frugal and you know how to pivot, you can see it through. Net, I will come back to where I started, which is it really is a golden era. I think we're seeing tons of interesting opportunities. We're so glad there are institutions like Rock Health that can accelerate the development of new ventures. We're enthusiastic supporters of the different conferences and meetups and gatherings where people learn from each other to advance things, and we're actively looking at seed stage startups in this space. So again, I thank you. Come, learn, be aware, and let's show the power of what this community can do in making a better world. Thanks much.